Thanks so much, Bruce. We have two more speakers. I'll introduce David Kaufman, and then he will introduce Phyllis Ben-Sasson, a family member speaking about personal perspectives. David Kaufman is the Director of Outreach and Education at JACS. He's a narrative and solution-focused therapist and a certified Canadian addiction counselor. He's been involved with community work for many years and has part of the life-changing JACS team. He's been involved with creating solutions for addictions, facilitates 3 weekly support groups, is involved in outreach and education in all segments of the community, and counsels families and those struggling with addiction.
I'm going to speak about the family. What happens when there's an addict in the family, whether it's a spouse, whether it's a child, whether it's a sibling, and what happens to the family and how they deal with it. Addiction is often called a family disease because it doesn't just affect the addict, but everyone that's surrounding. If you think about a disease, let's say, for example, Alzheimer's. A parent or grandparent has Alzheimer's. There's memory loss, there's mood changes, and it affects the family. And the family has to figure out, how do we now live with grandma or grandpa or whoever like this? And there's emotional changes that happen. Addiction has basically the same thing. It's a disease. The thing with addiction is that the symptoms of addiction are not loss of memory or mood, could be mood disorders, but the symptoms are bad behavior, lying, stealing, cheating, narcissistic behavior. I remember one family said that when their addict walks in the room, it feels like they suck all the emotional oxygen out of the room, leaving the family gasping from some emotional security, because that's what they do, and it affects the family. And nobody's prepared for this. When we raise our children in their diapers, we laugh with them, we love them, and there's no chapter in what to expect when you're expecting about addiction. And I've never had anyone who comes to my office and says, we sort of know what we're going to do with this. Everyone's in shock. And the most common question I get asked is, how do I fix my addict? How do I fix the addict? And the answer is, sadly, you can't. Right? But there's some caveats, and we're going to talk about that. We talk about 3 stages. This is based on Dr. Karn's work, who does a lot of work on sexual addiction, but it can be applied to this as well. There's 3 stages to early recovery. The first stage is overcoming denial. Second stage is education, and the third is a plan of action. When people discover that they have an addict in the family, they feel really confused, they feel anxious, they feel frightened, they feel ashamed, a whole host of emotions. You try yelling, bribing, manipulating to help them get better, but it generally doesn't work. So what happens is, slowly, over time, we start to change. We allow the addict to start affecting us. People begin to isolate from the community, from their friends. They don't go out because they're afraid somebody's going to say, well, how is Chaim or how is Sarah doing these days? Because they don't know what they're going to answer. Self-care, things that they do to nurture themselves are replaced by anxiety and worry. How many people spend nights waking up in the middle of the night, 2 o'clock in the morning, thinking about their son or daughter that's struggling, or spouse that's struggling with an addiction. They feel often as if they're hostages in their own home because the addict walks in and drama. And especially if there are other children, siblings, they are extremely affected. I can't tell you how enraged the siblings often are at the parents for all the financial, the emotional energy that gets expended on trying to fix the addict. And they feel like it's a triage situation. And it's years of this sometimes, where they feel like they have no voice. I've had situations where siblings have moved to the other, so angry, have moved to the other side of the country. Don't want anything to do with their families anymore. So, the first stage is about overcoming denial. We talk about really realizing what's happening, how it's affected their lives. And it's important because once you overcome denial, you have the energy to make changes. Energy, which is really the second stage, which is education. There's There's a phrase that says that you're only as happy as your most miserable child. You recognize it? It's a terrible phrase. Okay, and can you imagine if you have somebody who's struggling with addiction for 5 years, you're going to be miserable for 5 years? What about the other kids? You're going to walk around with a glum face and depressed, right? It's cruel. But we do also kind of recognize it, and that's why education is so important. One of the first things we teach when parents come in, or spouses or siblings come in, are something called the 3 C's. I didn't cause it. I didn't cause the addict to become an addict. I can't cure the addict, and I can't control the addict. Right? That's important. There's a lot of guilt and a lot of issues involved, and so we sort of say this is not something you did. There is a 4th C, and the 4th C is really the crux of what I'm speaking about. It's contribute. You, as a parent or a spouse or a sibling, can contribute to their healing, or you can contribute to their demise or more damage. One way people contribute is something called enabling. Enabling is doing something. The definition of enabling is doing something for somebody that they should be doing for themselves, age appropriate for themselves. For example, parents or spouses will call into work and say, he's not feeling well and he can't come to work today. Really, he has a hangover, right? That's enabling. Or paying their bills, or making excuses for bad behavior. Anything that passively or actively supports the ability of the addict to continue doing what they're doing is enabling. It's almost as if we roll out the red carpet for them and say, you can do anything you want, we'll protect you from the consequences. And so eventually the addict doesn't have to change because they're always being saved from what they've done. Without education, people make some really bad choices. I recall years ago it was an epiphany to me, going to a meeting, a support group for parents of children who were struggling with addiction. And a woman sat there crying. She told her story. She said for the last 10 years, she's been literally running around the world trying to save her daughter from her addiction. She went to Europe, bailed her out of jail. She forced her to go to rehab. She left after 3 days. She was constantly involved in trying to fix Sarah. And then what happened one day, Sarah decided she wanted to get better. The chutzpah of it was that the mother couldn't even claim that she was involved because she did it all by herself, right? But the woman sat there crying, and she said, for the last 10 years, my personality, my whole reason for being was to fix Sarah. And now Sarah's fixed, I don't know who I am. Right? This is what happens to families. And it happens to the siblings, it happens to the spouses, right? And so it's so important, whether the addict gets better or not, you have to get your life back. You have to learn that it's possible to heal again. And it is difficult, but it's definitely doable. In fact, we have a Thursday night group. A colleague of mine, Herb Waters, and I run a group on Thursday nights precisely for parents in that situation. So we've gone from overcoming denial, education. In education, I just want to add 2 more things about education. There are a lot of people who are well-meaning and will give advice, whether it's clergy, whether it's friends, sometimes even people in the mental health fields who don't really understand addiction, and they will give advice that is harmful. So you have to go to somebody who understands what you're dealing with. The other thing that happens without education is it's quite common, unfortunately, is people will Google or use the internet search, and they will Google rehab. And they'll start speaking to the rehab, and the rehab will say, yes, we can deal with this, and we can promise you, and they will promise. Rehabs are for a profit business, right? There are some great rehabs, but there are unfortunately some unscrupulous ones. So you don't just Google rehab, you have to talk to people that know what they're doing and how to match the correct rehab with the right person. So after the education piece, and there's more to say on that, but I'm going to just move to the last part, which is a plan of action. It's exactly what it sounds like. What are we going to do now? Now that we've overcome denial, we understand we've got a problem. Now that we've become educated, we understand what addiction is about. What do we do? A plan of action is about setting healthy boundaries, learning how to say no. Enough is enough. As one parent said, who lost a child to an overdose, he said, it's easier to learn how to say no than it is to learn how to say Kaddish. So there are several techniques, and I'm only going to refer to one of them tonight, because there are different ways of dealing and getting your life back as parents or spouses. And one of them that I use quite often is a letter. the letter form. The parents or spouses write the letter, and it takes several weeks, and we go through several editings, and finally it is presented to the person struggling with addiction. I'm going to read you one of the letters. Obviously the names and some of the facts and information has been changed. I'm just going to read it to you now. Dear Ari, there are so many beautiful things about you. We have celebrated, taken joy in, and encouraged the many wonderful and unique qualities you have. We hope and pray that one day you will be able to live them in a manner that you find pleasure and meaning in. You have a very kind heart, and we take pleasure in watching the way you manage to find things to do, generous things to do for people. How you stood up for that kid at school who was being bullied and made friends and looked out for Joseph when he transferred into your school. We enjoy watching you devour things that interest you and have you become a master of it, learning how to play the guitar, for example, or learning how to speak French, and a dozen other things that you've done. We admire your ambition and passion. Moreover, because we love you and celebrate your uniqueness, we notice when things are not going well for you, and know how significantly things have changed in the last year. Your marijuana use, what started out to be as an occasional Saturday night event, seems to have gotten out of control. We've noticed a lot of things have changed. Your passions have dropped off and narrowed to things mostly associated with smoking. Our conversations have become short, and we feel often as if you're just tolerating us. Once recently, you became physically aggressive with your mother, and she was scared by it. We rarely interact with you when you're not under the influence of weed. You barely see your friends, and it appears to us your physical health is suffering, and you're unhappy. We are concerned about your present and your future. This is all very frightening. Your moods and behavior have cast a dark cloud over the house. As we figured out, we have been attending a group for parents whose children are abusing drugs and alcohol, and we've learned there, precisely because we love you, leaving things as they are is not an option. We will no longer support passively or actively your downward spiral. For these reasons, we need to set boundaries for ourselves and for you to live and function properly. If you follow the new rules, you're welcome to continue living with our family. If you do not agree to these rules, you can obviously do whatever you want in your own home at your own expense. The new boundaries are, you must go to counseling with somebody who specializes in people struggling with drug abuse. Jack's phone number is 416-638-0350. You must attend a weekly support group for young adults. You must not have any drugs or other paraphernalia anywhere on our property. And if we find or smell them, and so on, any drugs for any reason, you will immediately have to leave our home. Or you can go to rehab. We love you unconditionally, but that does not mean we can support you unconditionally. That is to protect you from your own self-destructive choices and behaviors any longer. You are an adult and free to make your own decisions now. We do have faith in you that you will eventually work this out. Love, Mom and Dad. So I sit pretty much every week with parents reading and going through these letters, often a lot of tears. Tears of mourning and tears of relief. Relief because they're finally going to change something in their lives after all the suffering, and mourning because they don't know what's going to happen. It's scary. In summary, I am here to tell you that there is a way out. You're not alone. I know making that first phone call to Jack's or for help anywhere is really difficult. Walking into that first meeting, a support group, is really difficult. But as I tell everyone, for a few minutes of feeling uncomfortable, I guarantee you will gain a lifetime of education and support. As we jest also, we say that if you don't like what you hear, we'll gladly refund your pain and misery. So I want to step aside and talk a little bit about Jack's. JACS stands for Jewish Addiction Community Services. We're located at Wilmington and Shepherd Avenue West. Just about every week, 800 people come through our doors or make phone calls. They're seeking education, guidance, and hope for themselves and those that they love. Our mission at JACS is to help the community deal effectively with addiction as it is now and prevent it from spreading further. We do that through counseling. We counsel people struggling with addiction. We counsel parents. We counsel siblings who are in those situations. We run quite a number of group therapy programs every week for teenagers, young adults, for parents, we have an Orthodox women's support group for women in the Orthodox community who have children that have children who are struggling with addiction. We have a speakers bureau. We have outreach. We go to schools, youth groups. We're actually starting a day treatment program for people who are in early recovery or thinking about entering recovery. We're also starting another program, which is with parents. There's evidence that shows that if you teach parents how to speak to children about alcohol and drugs when they're younger, that there's a decrease of 26% of use and abuse later on in life. So we are starting a program now, going out to the schools and trying to get the parents involved so we can teach them how to do this. In terms of Ori was saying, the staff is amazing at Jack's. We have professionals with a variety of expertise, long-time recovering addicts, and men and women who are either not affiliated religiously to the Orthodox in our organization. I want to just tell you about a typical week. I mean, besides the groups that are going on, the counseling that is going on, and we host 12-step programs, Alcoholics Anonymous, Cocaine's Anonymous, all different groups going on all the time. Just in the last month, several things have happened. I received a phone call from somebody that I was counseling for a year, a young man who grew up in a home where his parents both were addicts. He came to Jack's for a year seeking counseling to deal with the damage that had occurred to him because of that. He called to say how grateful he was for our work and that he was now at the point where he could get married himself. Jay told me about a 17-year-old man, and of course I'm changing the facts again, who came to Jack's struggling with psychosis induced by marijuana. He was dealing drugs. Now he's finishing his third year in honors studying engineering. Marley, who runs our youth outreach program, spoke about a girl who called her after she did a program in the classroom about her prescription drug use. There are a lot of other cases. As Ori was saying before, Jack's receives about 7-8% of our budget from UJA, and the rest is privately funded. So I'm so grateful to be working at Jack's. It's an amazing organization. And I thank those who are supporting us so we can do this life-saving work. So I'm going to introduce Phyllis now. That was the end of that.